Hello, my name is Amanda Cheong, and I was a former PhD student in sociology and social policy here at Princeton University. I defended my dissertation in the spring of 2019 and have since moved to the University of British Columbia in Vancouver, Canada, where I'm a new tenure track assistant professor of sociology. I'm very grateful for this opportunity to share with you a bit about the research that I did with the generous support of the Center for Health and Wellbeing back when I was doing my dissertation fieldwork in Malaysia. This funding was important not only because it provided me with the resources that I needed to collect my data, but also in going through the process of writing my grant application, I was prompted to think a lot more deeply about the healthcare access and health consequences dimensions of the central problem that I was tackling in my dissertation. That problem was, why are there so many people around the world who continue to be excluded from civil registration systems? And what are the implications of being unregistered for people's lives? And so in this poster, I provide some detail about the qualitative method that I developed in order to understand the challenges that marginalized populations, namely migrants, stateless persons, and refugees, face in accessing vital documents such as birth certificates and marriage certificates. I call this method a document inventory, which involved essentially taking stock of the material evidence that households possess in order to prove their legal identities. The goals of this method is to count the number and types of documents held within a particular household, to understand how families ascribe meaning and value to the different kinds of documents that they have, to identify the challenges to obtaining the documents that families want, and to identify the impacts of not having documents for people's lives across different domains, including health. And I'm going to close by summarizing some of the findings from this research that pertain directly to health, specifically maternal health care access. In talking with members of marginalized households, specifically mothers and pregnant women, I found that, for one, encouraging contact with healthcare institutions is a widely recommended intervention for improving both maternal and infant health, as well as governments' ability to monitor them, as has been widely recognized in the literature. And this underlying rationale is that hospital personnel are often the first public witnesses to a child's birth and are more likely to be able to produce accurate information about the circumstances of vital events. And therefore, the production of um, statistical representations of a population's dynamic depends on the state's ability to systematically record the occurrences and characteristics of pregnancies and births. However, restrictive immigration policies, such as those that are in place in Malaysia, which prevents immigrants from being able to access essential health care, what this does is it pushes migrants to having out of system pregnancies and births. And the consequence of this is that these births take place outside of the government's knowledge. And finally, under-registration can be thought of as an intergenerational feedback loop, meaning that children are at a higher risk of being undocumented themselves when they are born to undocumented mothers and may possibly pass this status on, resulting in negative impacts both for health outcomes of these populations as well as governments' abilities to track and measure them. That's all that I'll say in this brief presentation, but I wanted to close by thanking Princeton University Center for Health and Wellbeing again for their generous support. I'm currently working on a book project and a number of journal articles based on this research, and I'm really proud to say that I was affiliated very briefly with the center on campus while I was a student, and that the time that I spent being supported by this grant is going to um, allow me to be able to carry on this research agenda in my capacity as a faculty member at the University of British Columbia. I'd love to connect with any of you out there. So if you'd like to reach out, I can be contacted at amanda.cheong@ubc.ca, which is on the bottom left corner of this poster. Thank you, take care, and be safe.